Guys, we're in the middle of a pandemic and these are trying times. It's hard on our mental health, our mental state. And this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees.
COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Quadcast Nation, it is Black History Month, and I wanted to bust out this episode we did with Duane Casares, who is one of the orchestrators of Directions for Youth and Families in Columbus, Ohio. And basically, he's part of a group that saw an underserved Black community in Columbus and really integrated them and provided resources addressing the main social determinants of health to really help that community prosper, improve the education, improve housing, improving economic status, improving the safety in the neighborhood, all these interventions through multiple partnerships. And, you know, they have success stories. Kids going to college when they, you know, nobody in that area getting out, going to college, you know, and you hear like how downtrodden these neighborhoods were, like no community resources, no parks even, and they, what we call changing the boogie. They took the power within their own hands. And I think this is just, I wanted to do this show to just provide those that want to serve and give you reason to serve. Two, also think about the framework, how to engage the community, not come in and telling the community how it needs to change and what you need to do to change, but actually being a partner, collaborating. And, so yeah, I think you guys are going to really enjoy this episode. So without further ado, Duane Casares. Quadcast Nation, listen, we have a very exciting episode today with Duane Casares. And what I'm so excited for you guys to hear is how they have changed the boogie, how they have engaged their community to really foster growth, to really be inclusive, and to get the answers from within the community to change the landscape. And it's such a beautiful model. And I don't even know where to begin, but Duane, thank you so much for joining us today.
Thank you for having me, and excited to meet Quadcast Nation.
So beautiful. So tell me, Directions for Youth and Families, like how did this begin? What was your journey? How did you get involved? Let's hear from your perspective.
Okay, so we're a mental health agency. We have like over 50 licensed therapists and counselors who work with kids, mostly inner city kids in Columbus, Ohio. One of the unique things with us is all of our services are outreach. So our counseling is in the homes, in the schools, in the community. Quite honestly, the people we serve aren't going to come to some mental health facility once a week for therapy. That's just not how it works in those communities. So we are gifted property in one of these communities, and we already have an after school and summer program. So we were going to build a new one. But what happened is when we got to that community, We did not realize that we were the only social service agency in that whole area. So this is a large area with like 6,000 kids. There's no park and rec center. There's no library. There's honestly no other social service agency there but us. And what we soon found out in working with the people in that community is the needs were so great. It was now the number one area in infant mortality. It was the number one area in evictions, number two in crime, and number three in poverty. And nobody was lifting a finger to help it. We knew we needed more than an after-school center. We knew we needed to do something to help this community heal. So what we started doing is taking van loads of moms from that community, because 76% of the people in this household are single-parent moms. And we were taking them to our Ohio Avenue Center, which is another center that we have, because we wanted them to be able to dream about what this new center could be. The center that we're in right now, the building that we were gifted, is only 3,800 square feet. We want to build a facility that's 24,000 square feet.
Wow. And I just want to emphasize, Duane, as a ICU doc, some of those risks that you were talking about, the poor education, the inability to have like even rec centers to keep the kids active and staying healthy. All these are risk factors from early death and landing in an intensive care unit and all this stuff. So I just want to put that lens on for the listeners that are hearing, like, why, what, Duane and folks are doing, why it's so important.
Yeah, I'm glad you lifted that up, because communities of poverty really come with it. These are traumatized communities. These are areas of toxic stress. When you have to worry about, as I mentioned, we were taking groups of moms to Ohio Avenue. One of the first groups, one of the moms talked about how her son was killed in those streets, murdered 10 years ago. And she's been fighting to get somebody there to help that community for 10 years, and no one's listened. Now think about that. You are a parent who lost your child to violence in that street, who was murdered. You've been trying to get help, and nobody's listening, and all you're seeing is watching your community deteriorate. So she actually said to us, "Are you folks angels?" Well, we cannot have that narrative coming out of moms' mouths. This should not even be acceptable. When you're talking about basic needs and basic safety and this should not be acceptable, that this happens to our children before someone will listen. It happened to hers, and no one still listened. So I knew we had to change that narrative.
Amazing. And how did you make this happen? Like, what were some of the steps you made within the community in Columbus to intervene?
Yeah, the first thing we did was we listened to the moms in the community to see what they needed. And because we are a trauma-informed agency from a mental health standpoint, we also started working with Bridge Housing Corporation out of Potrero Hill in California. They developed a trauma-informed community building model. So this was a trauma-informed community building model, which starts with communities having a safe place. I had been working with Bridge for several years and working with their model. We added the 5 social determinants of health to address. We added Annie E. Casey's 2-gen model, but we called it a multi-gen model. And then we added our own cultural assessment. We combined all those things to develop what we now call a community restoration model. And let me tell you, that's different than a community change model, because we used to think, can we have a transformation without gentrification? I mean, so many cities struggle with that. They transform communities, but they gentrify in the process. I wanted to see, can we do that without that? I will tell you what we learned. To consider it transformation is actually disrespectful to the people who lived in that community. This is about restorative justice. This is about restoration. This community that we're working on used to be a very prominent and thriving Black community in Columbus, Ohio. And now it's one of the poorest and one of the highest crime rates. And we need to restore what they had. This isn't about transforming. That's why we had to work with the people. I strongly believe, and we as an agency believe, we have to stop going into communities and throwing programs at them and then tell them to fit into our programs. We need to work with communities to develop the programming that they think would be most helpful. We have to listen. We have to work with them, not at them, not to them. And we just have to embrace that. And we're stronger for that, because we want sustainable change. And you're not going to have sustainable change when you do all the work.
Amen. Amen. And I've heard this from so many communities that have been able to assist with restoration and so forth, that it really does have to come from the community. The answers are within the community. So give us a sense of some of the changes that happened within the group, like in terms of improving on those social determinants of health.
Yeah, so we knew that we need to meet all of those things, but we're a counseling agency and we're an after-school center. We don't do all these other things. We don't run farmers markets. We don't have a community garden. We don't have an aquaponics center, but we needed to address that. We needed to stop the eviction process because when you don't have stabilized housing, no one's going to listen in school when you don't even know we're going to have a place to stay that night. I mean, these are basic things that have to be addressed. So we knew we had to do that. Well, we don't do all those things. So what I knew I needed to do is get nonprofit community partners and be intentional about who we invited to assist us in meeting the 5 social determinants of health. So that's what we started to do. I got the people who manage all the apartment complexes in that area. I talked to them about, look, if we can stabilize people from a mental health standpoint and get them employed, you don't have to evict them. And that saves you money because then you don't have turnover. So let's work together. And so I have 3 of them on board to work with that manage those properties. With food, I got the 2 agencies in Columbus who do community gardens, who do farmers markets, and who supply people with food. I don't have to do that. We don't do senior services. We don't have programming for seniors. Catholic Social Services does. They just don't have a place. So I partner with them. So right now, to address all 5 social determinants of health, we have 21 nonprofits who are joining us to address every one of these areas.
That is brilliant. That is brilliant. So, and in terms of the 5 determinants of health, so can you list them off?
Oh, yeah. I need to mention this, too. The thing about the infant mortality, we could not wait for that to change. You just can't. We can't allow kids to that rate to be so high, and they were number 1. So what we ended up doing was we partnered with Ohio Health, a hospital here, 3 years ago, because this has been 5 years in the making, and we put in a $7,000 electrical outlet unit so they could plug a semi into. They have been coming 3 times a month for the last 3 years, and they have been full every time. This community was hungry for even basic medical services, and it didn't have access to that. So that's important. So the 5 social determinants of health, education is one of them. Healthcare, what I just mentioned, is one of them. Neighborhoods and the environment, which is one of them. Social and community contact, which is one of them. And then economic stability, which is like employment. So those are the 5 areas that we had to make sure that we ended up addressing so that people could have pathways out.
And what I really like hearing, Duane, too, is the idea that, you're not going to try and recreate the wheel. You're going to call on people that have established this in the past, that know the path forward, right? And engage in them and saying, "Hey, help us out. How can we? How can help us out in terms of how we could do better? How we could address these 5 determinants of health?" And I don't know. But it seems like a formula for success. Like how you guys did this.
Yeah, well, first off, I have no business going into other areas that we have never done anything with. And honestly, the people we serve deserve better than that. They deserve better than me trying to invent something that I've never done before. So I always tell people, look, the people that we serve, they don't get to be in the room or at the table that I get to. So I have an obligation, a duty to speak on their behalf. And that meant securing them the services that they need, and even the services from some people that they may trust. So we have to listen to them as well. We have to listen to who they're familiar with, who they're not, who they're comfortable with. And we became a vaccination site because, as I told the Department of Public Health, they ain't trusting you. They trust us. I mean, truly, they trust us. So we need to be that, so that the people in our community can get vaccinated. So that's what we did. It's truly one of these things that you build with a community by being in partnership with them, by walking side by side with them, not telling them what to do or throwing something in there and saying, well, use it. That's just not how it works.
And Yeah, I love it. I love once again, you're walking as partners, you're going with them in this journey. And this really is incredible. How long has the program been running?
Well, we're in the end of our capital campaign right now. So we have to build a new building. Right. To bring all these programs together. So this is our model. This is what we have put out there. So it's been over 5 years in planning and putting this together. We're looking to break ground hopefully in about 2 months. The pandemic increased the cost of lumber and steel and everything. So we thought we raised enough for the building, and now we have to raise about 1.8 million more because prices went so high I couldn't believe it. But we're going to get there, and then. We want to make this transferable to other communities so other communities can have this model so they can start really to address social justice, what I believe, from a restorative, a responsible standpoint with some of our struggling communities.
Yeah, it's so important. Yeah, thanks for that, Duane. I know it's been 5 years, but is any kind of success stories or kids that have come through, that come to mind when you think of the impact that you guys had?
We have another center that's actually 22,000 square feet. So we have an after school and summer program. It just doesn't have all the 5 social determinants of health, but we added that to this model. And I'll tell you why. In that community, it's another very, very impoverished community in Columbus. In the last 3 years, we have sent 7 kids out of our program to college through our music program. Many of them have been with us since the 6th grade. Some of them got 4-ride scholarships. This does not happen in that community. I got to tell you, we have this whole big board with their pictures on it and everything because people need to see that people that look like them and that grew up in their community can aspire to be something more than that community. And we're very proud of these 7 going to college. I will tell you, the first few years, it was only 3 guys, but last year we had 4 young girls who are now a part of 4 young Black girls who are now going to college out of that community. And I am thrilled I'm so proud of them. They have worked so hard. Like I said, many of them have been with us since the 6th grade. And they're like partly family. The kids feel that way. So we celebrate these things hugely.
Listen, it brings so much joy to my heart hearing this, because once again, as you said, once they see that dream can happen, when they see that this is attainable, it lifts so many people, it lifts the community, and it says we can do this, we can collectively do this and build themselves out of this, unfortunate situation and really have that dream of prospering.
And listen, everything you just said, that's all about hope.
Yeah.
And there are times when we're in communities and no one's helping us, when they don't give us a library, they don't give us a rec center, they don't give any services there. It's hard to have hope. It's hard to dream. It's hard to think that there's a path out. So we have to change all of that. And honestly, the kids, if you think about it, the kids are changing the path for the next kids.
100%.
They're the ones really. We're assisting them, but they're the ones doing the work. Let's be clear about that. We have the easy part. They have the hard part. They're the ones who have to put in the effort and change. We're just going to walk that path with them. So when we celebrate these triumphs, it is all about what they did. Not about what we did. It's what they accomplished and what they are now contributing to and what they're passing on to their nieces and nephews and next door neighbors and brothers and sisters. It's critical that you be able to see that you can do it because others like you are doing it as well.
And Duane, I'm hoping by just really amplifying what the most beautiful stuff that you guys have been doing, that not only is it you guys already clearly impacting the community within Columbus, but I want it to scale. I want everyone to hear this and really provide motivation to engage your community and help those that are less fortunate so that we could grow together. And I call it community healing because they are responsible for part of that healing. So we're not doing it for them. So that when they do it, they're ownership for it. And it's critically important that stays with them. We're not trying to foster dependency. We're not trying to give handouts. We're not trying to rescue people. What we are doing is assisting them in their journey to have the basic things that all humans should be able to have, the same opportunities, the same hope, the same future aspirations. Wow. Listen, Duane, I got to thank you for coming on the show, providing the inspiration that a lot of us need right now. And I want to wholeheartedly thank you for what you and your organization have been doing in a heavily marginalized, racialized community, Black community that can be transformational. And I really commend you for the work you're doing. And thank you so much for coming on the show.
I appreciate the opportunity to speak to Quadcast Nation. I love that, by the way.
Thanks so much, my friend. Talk to you soon. Quadcast Nation. Hard not to get a little bit clamped listening to that episode. I loved it. Thanks so much, Duane. Follow us on Instagram, YouTube, TikTok, Facebook at Quadcast. Leave any comments at quadcast99@gmail.com. Check out solvingwellness.com. We're changing the landscape of burnout within healthcare providers. We're trying to change that boogie. This is trying times for healthcare providers, so this is our way of trying to address it. So go to solvingwellness.com and listen, everybody. Thanks so much for listening. Thanks for the 5-star ratings. Thanks for the support during these crazy times. We love you, and we'll connect again real soon. Peace.